Hello and welcome. You're listening to the Sickle Cell Action Network, an internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Prolong Pharmaceuticals. We're coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We've designed this show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we're going to be talking about sickle cell in America's Mid-South region. My guest will be Dr. Trevor Thompson, the founder and CEO of the Sickle Cell Foundation of Tennessee. Although he has sickle cell disease, Dr. Thompson has devoted his life to helping others with the condition. It should be a great conversation. We are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you will find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. As always, there are things happening in the sickle cell field, and one of those that I'd like to share with you is a press release that came out earlier this week about the fact that Global Blood Therapeutics and the FDA have reached an agreement on a pivotal trial design for a new sickle cell disease drug. And the article reads like this: Global Blood Therapeutics unveiled Monday the design of a pivotal Phase 3 clinical trial for its experimental drug GBT440 in sickle cell disease. Most important, the study's primary efficacy endpoint will measure the ability of GBT440 to increase levels of oxygen-carrying hemoglobin in sickle cell patients compared to a placebo. That's a potentially easier efficacy threshold for GBT to achieve in sickle cell disease compared to what's historically been required by the U.S. Food and Drug Administration. Typically, FDA has mandated any drug aimed at treating sickle cell disease demonstrate a reduction in the frequency of painful and damaging sickle cell crises. These vaso-occlusive crises are caused by clumps of sickled red blood cells blocking blood vessels. Global Blood says the FDA agreed on the design of the GBT440 Phase 3 study, including the use of the hemoglobin primary endpoint. However, the agreement on study design and the data required for the drug's approval is not guaranteed in writing with a special protocol assessment or an SPA. We did not pursue an SPA. Had we done it, we could have gotten one, but it would have taken longer, said Global Blood CEO Ted Love in a phone interview on Monday afternoon. Global Blood wants to start screening sickle cell disease patients for the Phase 3 study in December, with the hope of having top-line results in the first half of 2019. I don't think FDA felt we needed an SPA, Love added. Our process with the FDA was trying to reach an agreement because this study is important for us and for the agency. I do know this decision, the trial design agreement, was endorsed at the highest levels of the FDA based on our discussions with them, Love said. Global Blood's GBT440 works by modifying hemoglobin, the oxygen-carrying protein inside red blood cells. GBT440 makes oxygen attach more tightly to hemoglobin. By keeping hemoglobin in a highly oxygenated state, the mutation which causes sickle cell disease is covered up, preventing red blood cells from becoming deformed and clumping together. GBT440 is a pill which sickle cell patients would take once daily for the rest of their lives. Global Blood's Phase 3 study will enroll 400 patients with sickle cell disease who have had at least one episode of vaso-occlusive crisis in the past year. So Global Blood Therapeutics is moving forward, preparing for their Phase 3 clinical trial. We certainly hope that they have better success than Mass Therapeutics did with theirs. And also we're looking forward to our sponsor, Prolong Pharmaceuticals, and the emergence of their clinical trial. The next story concerns sickle cell trait, and we're hearing about this more and more and more, and we're also hearing about it more and more and more in the National Football League, and this story is referencing that. There is a player who plays for the Green Bay Packers. His name is Ty Montgomery, and Ty Montgomery has sickle cell trait. There was a story in the news a few days ago, and let me share that with you. This is coming to us from Green Bay, Wisconsin. And it reads like this. The symptoms that kept Ty Montgomery out of Sunday's loss at Atlanta related to sickle cell trait, a condition the Packers receiver said he had been diagnosed with previously. However, he said last week was the first time he ever experienced any issues. Sources told ESPN on Sunday that Montgomery had blood in his urine, and the Packers kept him out for precautionary reasons. Montgomery said he and his doctors believe that was related to sickle cell trait, not a hit he sustained during a game, and don't think it's career-threatening. In fact, Montgomery hasn't ruled out playing Sunday against the Indianapolis Colts at Lambeau Field. It doesn't concern me, Montgomery said Monday. A lot of people have sickle cell trait, and some of them don't even know, and not everybody experiences symptoms of it. I'm not concerned about anything, he said. Montgomery was at least the second NFL player to reveal he has sickle cell trait recently. Arizona Cardinals receiver John Brown said he discovered it after a series of hamstring issues. Montgomery, the second-year pro who has played both running back and his natural receiver spot this season, was coming off consecutive games with double-digit receptions and also rushed 9 times for 60 yards in a Week 7 victory over the Bears. He would not say whether he was cleared to return to practice this week. We're just going to take it day by day, Montgomery said. So far, all signs lead to we feel confident to just take it day by day and play this week. So we'll see. So good luck to Ty Montgomery in his quest to keep playing with sickle cell trait. And also, we thank the media for bringing forward information about the fact that there are at least 2, and this article says 2, but I'm aware that there's at least 3 that are sickle cell trait carriers who are in the National Football League at the present time. Our last article comes today, and I think this is an important one. We've touched on it in the past on the Sickle Cell Action Network. This is from the Vanguard, coming from Africa, and the title of this article is Depression, Anxiety, Risk Factors for Suicide in Sickle Cell Disorder. And it reads like this. Mrs. Maureen Osuji, an Abuja-based clinical psychologist, says depression and anxiety are major risk factors for suicide among sickle cell patients. Osuji said on Friday that sickle cell disorder was a global health problem with psychosocial implications. She therefore advised patients to seek specialized medical intervention. According to her, studies in Nigeria had shown that sickle cell disease had a prevalence rate of depression greater than those of cancer patients, but less than persons with HIV and AIDS. Osuji said the rate of depression was also similar to those found in chronic medical disorders ranging from 18% to 44%. Osuji explained that such prevalence was a major risk factor for suicide. The despair and hopelessness that comes along with depression can make suicide feel like the only way a sickle cell patient can escape pain. Suicide talks and behavior should be taken seriously, such as unusual preoccupation with death or dying, expressing feeling of being trapped or hopelessness, and acting recklessly, she said. She said that studies of depression in children with sickle cell disease have shown mixed results, including high rate of fatigue, frequent hospitalization, impaired self-esteem, and inability to experience a normal childhood. Osuji listed signs of depression to include loss of interest in daily activities, social activities, sex, as well as loss to feel joy and pleasure. Others, she said, include changes in sleep, anger or irritability, feeling agitated, restless or violent, loss of energy, sluggish, and being physically drained. She said that early intervention was very crucial in managing sickle cell patients, as well as adequate psychological support to improve an individual's life. The clinical psychologist identified psychoeducational intervention as therapy focused on improving the knowledge and understanding of patients regarding their illness. This approach emphasizes that the information provided can lead to improved knowledge and better coping with the condition. Secondly, she says, patients who feel isolated could benefit from the support and motivation of others through shared experience. Other interventions include cognitive behavioral therapy, which aims at challenging and changing inappropriate, self-defeating thoughts to enable the patient to lead a productive and satisfying life. This is really, really important, folks. We want you to be sure that you pay attention to those signs of depression that could lead a person to seriously consider suicide. And again, some of those signs are changes in sleep, anger or irritability, feeling agitated, restless or violent, loss of energy, sluggish, being physically drained, loss of interest in daily activities or social activities, loss of interest in sex, as well as loss of joy to feel loss to feel joy and pleasure. Thank you to Dr. or Mrs. Maureen Osuji for her statements. So with that, we will conclude today's episode of the Sickle Cell News Update. When we return, we will start our discussion with a tremendous individual who has sickle cell disease, but that doesn't get in his way. It didn't stop him from raising lots of money to start a brand new sickle cell center in the state of Tennessee, and his name is none other than Dr. Trevor Thompson. When we return, we'll start speaking with him. This is the Sickle Cell Action Network Internet Radio Show, and I am Gary A. Gibson, your host. Ladies and gentlemen, welcome back to the Sickle Cell Action Network Internet Radio Show. I'm Gary A. Gibson, your host. It is Tuesday, November 1st. We have 1 week to go before we can draw the curtain on this tremendously aggravating, I'm going to call it, aggravating election season. And it is our hope that whoever is elected president, whoever is elected into our Senate seats and our congressional seats, that each and every one of them pays some attention to doing something more for sickle cell disease. That is our hope. Anyway, it's my pleasure to bring on to the show today one of the people who I think is an outstanding leader in the field of sickle cell here in the United States. His name is Dr. Trevor Thompson. Trevor is a pretty humble person, so let me share a little bit of information about him, because I'm not sure he would tell you all of this, but this is quite impressive. He has a certification in philanthropy and nonprofit leadership. He is a certified community health worker. The Memphis City Council has recognized Trevor twice for outstanding commitment to the community. He was named the 2009 Stone Awards Humanitarian, and the Sickle Cell Foundation of Tennessee was recognized as the 2010-2011 National Community-Based Organization by the Sickle Cell Disease Association of America. Trevor Thompson holds memberships in the Xavier University of Louisiana Memphis Alumni Chapter, President, Xavier University of Louisiana National Board of Governors, Second Vice President, Alpha Phi Omega Fraternity, Life Member, Phi Kappa Phi Honor Society, Life Member, Pinnacle Honor Society, Sigma Pi Phi Fraternity, Association of Fundraiser Professionals, Alliance of Nonprofits, National Academy of Science Forum on Regenerative Medicine. And I don't think I'm done yet, but I'm going to stop there just I think that gives you a sense of the tremendous person we're about to speak to. So it's my pleasure to welcome you to the show, Mr. Thompson, and I'm very happily looking forward to speaking with you. So, Trevor Thompson, welcome to the Sickle Cell Action Network Internet Radio Show.
Gary, man, I appreciate you having me on. You know, I've been excited and preparing for this for about 2 weeks now.
Yeah, that's about right.
Just really excited, you know, to get on, and we've talked about your radio show, and I just want to congratulate you for, you know, finding this medium to give out information, the unique way of giving out information concerning sickle cell. So I'll applaud you for your efforts in doing this as well.
Well, thank you so much, Trevor. I'm going to start by saying I don't know if you know this, but I do have a lot of respect for you as an individual. I'd like others to get the chance to be as impressed as I am. So besides what I just said, because I know I didn't say everything, would you please tell us a little bit about yourself? Where are you from originally? How long have you been serving in your current role? And since you do have sickle cell, I always ask my sickle cell guests, you know, what type of sickle cell do you have? So let's start with that. What type of sickle cell do you have, Trevor?
Well, I have what they consider SC disease, SC sickle cell. And I didn't find out officially, Gary, that I had sickle cell until I went into the service.
Okay. So what branch? What branch of service?
I went to the Army National Guard.
Okay.
And I always had this this passion about me about serving in the service. But I was born in Baltimore, Maryland, and I was reared in Tuskegee, Alabama. And in growing up in Tuskegee, most people have heard of Tuskegee Institute or Tuskegee University, which it is now. But it's a rural community outside of the university setting. And for a number of years, I grew up thinking that I had the trait, but I would have symptoms or go through what we now consider sickle cell crises. And through those years, my mom would take me to the hospital, and they were saying that I was faking, or, you know, they would do the test, and it didn't show that I had any sickle cell. And in those times, and Gary, you're familiar with this as well, you know, we didn't have a lot of research concerning the other aspects of sickle cell.
Right.
All you heard about was SS.
Right.
And sickle cell trait. You either had SS or you had the trait.
Mm-hmm.
And so actually, I tell people that I didn't have a lot of issues as far as organ damage in relationship to sickle cell or narcotic situations, because my grandmother used this old-fashioned remedies to take care of me in terms of dealing with my pain. And that's things that we use today, the heating pad, and she would mix sulfur with Dick Salve with the Vicks Vapor Rub, and kind of use that ointment to get my body heated up and kind of get me through the pain episodes. So it wasn't until I went into the military that I went to Fort Jackson on Tank Hill and did some excessive exercising and went into the hospital, and the doctor came in the room and said, "Has anyone ever told you you got sickle cell disease?"
Oh, my Lord. What a rude awakening, right?
Rude awakening, but I tell people this all the time here. I was so excited, or I was happy, because it kind of validated, you know, everything I had went through as a child. It's like my mind wasn't playing tricks on me. I was actually very happy that, you know, there was kind of a diagnosis.
Yeah, I can see that. Yeah. Yeah. Wow. So then, did that affect your service in the military? What happened after you got diagnosed?
This is very unique. I argued to stay in the service. They wanted to do a medical discharge, and I guess hindsight is 20/20. But I had this in my mindset, kind of just growing up around my grandfather and my father, that I wanted to complete everything that I had finished.
Uh-huh.
And so I ended up graduating from what we consider basic training, and end up continuing to go into the service to what we have at the time, they might have changed the name now, called like an AIT, which is kind of your skill training, when you get an MOS of your military skill.
Okay.
Mine was supply specialist, dealing with how to take apart guns, putting back together different weapons in the armory and things of that particular nature. And that's what I love to do, and was real good at it.
Okay.
And then I ended up getting sick again, and they offered me the opportunity to get an honorable discharge.
Uh-huh.
And so I took that opportunity to take the honorable discharge.
Okay.
And ended up leaving Fort Jackson and headed to prepare myself to go to Xavier University in Louisiana. And there I began really my first indoctrination of working with the Sickle Cell camp, as far as, working in a area or arena centered around helping those who are like myself living with sickle cell disease.
Okay.
So that was like 1987.
Okay, so it's been a long time. You've been involved a long time. Yeah, just like me. But so how long did you end up being in the service total then, between the time you started and the discharge? Honorable.
Here, because in those days, especially with the Guard, you could answer while you were in high school.
Uh-huh.
And then once you completed high school, then you would go to basic training. So I think I started like maybe February of my senior year in high school. And then you officially went to basic training that summer. And then I ended up being discharged, may have been sometime in September, October. And I had a couple of months that I worked until I went off to college.
Okay.
I was going to college anyway because I was going to be in the Guard.
Right.
A lot of people don't know, when you go to the Guard or Army Reserve, you still have to go through the same basic training at that particular discipline that you're going in. As far as, in my case, it would be Army.
Okay. Well, thank you for sharing that, Trevor. I appreciate that. So you've got this organization, the Sickle Cell Foundation of Tennessee. You started it. When was it that you started? When did you found it?
We were founded in 2008.
Okay. And your original location was it in Nashville or Memphis?
Actually, the original location was in Memphis.
Okay. Okay. And go ahead.
Quickly, we saw the need because people were reaching out to us throughout the state, talking about, how could we service them as well, as far as, the services that we were providing. And so within a year's time, we ended up changing the name. The original name was Diggs Crowd Sickle Cell Social Services Foundation. And then within a year, we ended up changing it to the Sickle Cell Foundation of Tennessee.
Okay, repeat that again. What was the original name?
It's a long name, Gary.
Yeah, it's a long name. Kind of hard to put an acronym together for that one.
It was the Diggs Crowd Sickle Cell
Okay.
Social Services Foundation.
Wow.
And the reason we named it after Dr. Diggs and Krause, and they're some of the pioneer researchers here in the Memphis area, and we wanted to kind of give them some, homage of the work that they had done.
Right.
And a lot of people don't know that Dr. Lemuel Diggs gave the concept of St. Jude to Danny Thomas.
Okay.
And so St. Jude's first patients were sickle cell patients.
Right. I knew that. Yeah.
Because Dr. Diggs, that was his primary research area, was sickle cell. And one of his assistants, who ended up being a mentor and a board member emeritus, who actually passed away 4 years ago now, Miss Ann Bell, actually is the person that found the C crystal in terms of what we consider SC disease.
Okay.
And so she is the one who published all of Dr. Diggs' papers and things of that nature. So we kind of wanted to honor that history by naming the foundation after him. But because of the need across the state of having a community-based organization, we went ahead and changed the name.
Okay, Trevor. That explains things a lot. And I think I understand you wanting to give homage to Dr. Diggs, but it sounds to me like you did better to change the name. Yeah. Okay. So, but when you started this, are you telling me that there was no sickle cell organization at all in the state of Tennessee, or was there ever any?
There was one initially, and to my understanding, it was called the Mid-South Regional Sickle Cell Foundation, and it was very active, I would say, in the 70s, and probably a good part of some of the 80s, I heard. And me not being a native Memphian, of course, I was
Okay.
And I was a volunteer of the chair of the Big South. The Big South is also the name of our clinic here.
Okay.
The Big South Sickle Cell Clinic, and we had an advisory council, and I ended up chairing that particular council for like 15 years.
Okay.
And at least I know from 95 and maybe 10 years prior to that, we didn't have what I would consider a community-based organization.
Wow. Now, how many people do you expect or are estimated to have sickle cell in the state of Tennessee?
Right now, we're estimating anywhere from 2,500 to 3,500.
Okay.
As you know, that's one of our goals in terms of
Right.
connected is to reach out in these communities to find out actually who has sickle cell.
Right.
So we can get a better estimate and a better count, rather, of who's actually affected with the disease in the state of Tennessee.
Mm-hmm.
And we also cover East Arkansas and North Mississippi.
Right.
A lot of people don't know that Tennessee borders 7 states, and but we literally right across the street. There's Arkansas in one direction and Mississippi in the southern direction. So those particular states we definitely cover as far as a good majority part of those states we cover as far as providing service to their clients.
Right, and that
drive into Tennessee to be seen.
and that's why we named the show today the Sickle Cell in the Mid-South, because you are covering those areas. I was aware of that. And I mean, do you have much coverage in Arkansas or East Arkansas and Mississippi? Do you have a lot of clients that you're working with in those areas?
Oh, most definitely. And we cover the same area in which the hospitals, like St. Jude, is a strong partner of ours. And of course, we provide all of the social services to their clients who are affected with sickle cell. So we deal with a lot of the parents of those children in those various communities as well. And then when we have our advisory council meetings, we actually have clients that come over from Arkansas or North Mississippi to participate in the various activities that we have as well.
Awesome. You're doing great work. I'm going to ask you one more question, then we're going to take a break. But this question is, you personally are very well respected within the Sickle Cell Disease Association of America's membership, and I've watched that firsthand. How long has SCFT been a chapter member of SCDA? When did you join them?
Actually, it was very soon after we formed the foundation.
Okay.
It was around 2009.
Okay.
And our situation was kind of unique compared to others because I had been attending the SCDA since 1995 as well.
Oh, really? Okay.
Right, and as you know Gladys Robinson and all
Yes.
those other Lewis, and began to kind of, learn under their tutelage on how to run a nonprofit and things of that particular nature for many, many years.
Uh-huh.
And I was kind of already kind of established in the SCDA community. I just didn't have a CBO. I was kind of an honorary person with St. Jude coming to the conference.
Gotcha. All right. Well, Trevor, if you can stay with us, we're going to take a break, and when we come back, we'll keep speaking and let people know more about the great stuff you're doing. This is the Sickle Cell Action Network Internet Radio Show, and I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network Internet Radio Show. I'm Gary A. Gibson, your host, and I am speaking today with Dr. Trevor Thompson, the founder and CEO of the Sickle Cell Foundation of Tennessee. This is a tremendously accomplished person who just happens to have sickle cell disease. And during the break, we were speaking a little bit about politics, and we really want to stress how important it is for those with sickle cell to be sure to be advocating for themselves and for their community. And Dr. Thompson was just speaking with me about some meetings that he's having with legislators, and he feels as passionately about this as I do. Trevor, one thing that I constantly refer to a phrase that was spoken by Frederick Douglass, and that phrase is "power concedes nothing without demand." And I use that as sort of a mantra to try to explain to those that are affected by sickle cell that silence gets you nothing. And you do have to speak up. You do have to let people know not only that you exist, but that you have needs. You agree with that?
Definitely. When you first said that goes with the quote, I thought you could probably say one of my favorites dealing with there's no struggle without progress, no progress without struggle.
Right. Right.
And I guess it's twofold in the point that we, as community-based organizers and leaders, have to do a better job in educating our clients or population in terms of the importance of the politics as well as legislatively of how to speak and or develop proposals to ask for what we want. Because if we don't have any voice, if we don't have an agenda, then we're going to be overlooked. I mean, if you're not at the table, more than likely you're on the menu. So, we just need to do better at being at the table, and that's what I've been trying to promote, and try to do, is be at the table.
Well, I've spoken a lot, Trevor, about the disparities that exist between some of these diseases that affect fewer people than affects sickle cell. And in fact, last Friday I spoke at the University of Notre Dame, and I shared some very interesting information. So among the things I shared is the fact that cystic fibrosis and ALS, both who have total patients less than those with sickle cell disease, have many times more resources and money, and some of the reason for that is because they were at the table and they were demanding, and that's what we need to get people to see, that demanding, and I don't mean demanding in riots, I just mean being there and talking and asking. That's what gets things done. That's what those other organizations have done. That's why they are so far ahead. That's why they are so well funded. And so we are constantly here in Indiana trying to urge patients, our clients, to come with us to these meetings that we have when we do talk to legislators, and I know you're doing the same.
Most definitely. And I'm working with this board, and actually consists of some legislators. And the part of the curriculum we're developing is to go into the schools and teach our children about the legislative process, and understanding about committees and how bills are developed. Because we've gotten away from that Saturday morning show. Remember, I'm just a bill. I'm only a bill.
Yeah, right.
Right. But, that little song or that little cartoon at least provided us a process on how things are really done. And we don't have that anymore.
Right.
And so I want to utilize that curriculum and those talking points to even educate the sickle cell population, like you said, about how do we go about not just saying we're going to be at Sickle Cell Day on the Hill just to take pictures and talk to legislators, but also to have an agenda in place.
For sure. You have
of demands of what we're trying to do.
Exactly.
And say that message in an articulate, and as you say, as the numbers as a team, this is what we want to do, and this is, what we're asking.
And we also have to keep asking. That's the other thing. It has to be ongoing. It's not, like you said, it's not one day on Capitol Hill. This has got to be a constant, well-organized effort. And I think we're getting closer to being able to say we're getting there. But we still need to be sure that we have those people that are most affected to be involved in the conversation. It's one thing for you or me to go in front of a legislator and say we need to do this, we need that. It's another if I go accompanied with 100 people, and same with you.
And one of my leaders that I really truly admire, and I'll keep her name private, but she said, Trevor, what's the point in you having 5,000 people following you on Facebook if you cannot galvanize those 5,000 people?
Absolutely.
For your agenda.
Absolutely. All right, so let's go back now and talk to you about your Sickle Cell Foundation of Tennessee. And let me ask you, how many clients do you serve currently? And then I'm going to ask you, has that number been the same over the last few years? Is it changing? Whatever. So how many clients are you serving right now, Trevor?
Presently, we have about almost 1,000 people in our database. And
Wow.
It's funny that you asked today because we're getting some data updated.
Uh-huh.
But the young lady did tell me over the 8-year period of time that we've been in existence, service close to 3,500 people.
Okay. That's pretty impressive.
3,500 services, and I know from getting the analytics from commercials and things that we do on the television that we probably educated, we have definitely educated more than 1 million people in terms of television features and things of that nature and social media platforms and what have you.
Okay. Pretty impressive. Good work. And is this number changing, by the way? Do you see growth in the number of people?
Growth definitely in the numbers, and I would have to say that Get Connected kind of attributed to that as well.
I agree.
Challenged us to kind of get out of our comfort zone, and we also have partnerships with Vanderbilt and Meharry Medical School, and because of that partnership, we were allowed to kind of build our infrastructure somewhat to have more people on staff. And what we have is community ambassadors, and we have a rural community ambassador, so we are able to really go out in the rural communities now and engage and educate in terms of around sickle cell.
Interesting. You know, I want to ask you about that, the rural versus the urban, because I think in some states around the country, you're going to find a really heavy concentration of sickle cell patients living in the urban areas. But in, I think, a region like where you are, don't we have a lot of them in the rural areas?
Oh, I would say 1/4.
1/4, uh-huh.
In the rural area.
Right. And see, I don't think that's true here in Indiana. I mean, I think we have, I would say it's probably closer to 85 or 90% of the people that have sickle cell are living in an urban area, but I knew it would be different down there.
Right.
Yeah. So what about the demographics of your client population? Do you have any sickle cell patients that you serve who aren't of African heritage? If so, about what percentage of your clients would they represent? Or are you pretty much all exclusively African American?
I would say definitely less than 1%. We have serviced some individuals that are not African American, and we have been a part of, with the exception of this year, with a scheduling conflict, we've always been a part of the India Fest.
Okay.
As you vary, India is a
Right.
country of India, half the population is sickle cell.
Right.
And so we got engaged with India Fest to do more education in terms of sickle cell.
Mm-hmm.
But we have found out that those individuals, and you probably need to get more data on this, but this is strictly analytical in terms of that these individuals go through private and not through the systems that we're familiar with in terms of being treated for sickle cell.
Right. Right. So that's kind of a cultural thing, right?
Right.
Okay. So what about the ages of your clients? You got them all ages?
Oh yes, from all ages, and we end up having we actually lost a close friend of mine last month with sickle cell, and he was 72.
Okay.
Yes, from all
72.
ages.
So with that being said, do you know how old is your oldest sickle cell patient client?
This guy would be about 74 years old.
Wow. Awesome.
Yeah, and she wouldn't mind us telling you because she'll tell you that in a minute.
I appreciate that for sure. So you've told us a little bit about what you do, and I think in fact your agency is pretty similar to ours. We both provide services, outreach, education, and advocacy. Which of the services that you offer now are being the most utilized?
And the most utilized utility assistance.
Okay.
Followed by a close second, probably with the housing assistance.
Right. I'm going to talk to you about that in some more detail in a few minutes.
Now, the only reason that our numbers are not higher in terms of transportation is because with most people you would think that would be the highest one is because that St. Jude provides transportation their children.
Okay.
So we don't have to encompass, that cost when it comes to West Tennessee, where a bulk of the children are, living with sickle cell.
Right. Right. And honestly, let me ask you to tell us a little bit about your relationship with St. Jude, because honestly, I'm sort of envious that you have such a relationship, and we haven't been able to strike a relationship like that, like the one I know you have. Tell us a little bit about that relationship.
Well, actually, it was St. Jude, and you met Yvonne Carroll, who goes
Yes.
to the conference.
Yes.
For a number of years, I was talking about starting a foundation, and it was actually Yvonne Carroll and St. Jude who encouraged me to go ahead and move forward with it.
Okay.
And because literally I did have it on my plate for about 4 or 5 years, in my spirit to do. And once they got an opportunity to do some grants and wanted to partner with a community-based organization, they said, Trevor, you need to move forward. You already have the structure kind of in place for the contacts and so forth and so on to move forward. And that's what we did. Just because of the support of St. Jude. And then as we began to develop and, kind of get out that infancy stage, they then transitioned some responsibilities that they were doing at St. Jude to the community-based organization, which was inclusive of trait testing and their sickle cell camp, which in turn expanded and built capacity for the foundation as well.
Excellent. So you sort of got ahead of me just a little bit, because I was going to ask you, do you provide newborn screening services? Or follow-up, I mean.
And we do that in partnership with Meharry.
Okay.
Meharry kind of gives out all of the testing materials. And we have a contract with a young lady who actually has her own company, and she happens to have sickle cell, but she does all of our trait testing for us.
Okay.
And so typically we've been doing it at major events.
Okay.
And publicity. But this year we decided to do something different, and we kind of brought it to the barbershop. So every other month, there's a particular barbershop that's kind of convenient in the downtown, midtown area.
Uh-huh.
And we were trait testing at Michael's Magnificent Barbershop.
Huh.
And so that's kind of been going over pretty well in the community, so people don't have to go to the office or, definitely, not back at the high school setting. I mean, not at a hospital or healthcare setting, but it's in the barbershop.
That's real outreach. That's pretty innovative. Good job. So then what about, well, let me ask you this. What about funding? So where are you getting your funding from? And I've said this before. I've interviewed Talana Hughes from Sickle Cell Disease Association of Illinois and several others, and I always ask this question of the CBOs, because funding is a real challenge for us, and I'm pretty sure it is for you. But tell us a little bit about how your funding stream is working.
Well, right now, our funding stream is working with some funds from the state, and looking hopefully to increase that for next year's fiscal cycle. And then we get funding from various, fundraising initiatives that we do, as well as grant funds.
Okay.
That we either done with McCory and our partnership with St. Jude. Like again, we have a grant that we just received actually, that we have with St. Jude for the next 6 years.
That's great.
We have a grant that we consistently had a grant with Vanderbilt University Sickle Cell Center in conjunction with support from Meharry. And then something else unique that we've done, we are a CFC, Combined Federal Campaign.
Right.
So we receive funding from them every year, and we make sure that we go to the required meetings and health fairs and things of that nature. And then the other thing that we recently just happened to do, we became a member of the Tennessee Employees Charity Campaign.
Okay.
Now, any Tennessee employee who wants to give to the foundation, they can. And we've also set that relationship up recently with Nike.
Really? Nike?
Nike Global.
Wow.
So any Nike employee across the country, or around the world actually, who wants to, as a Sickle Cell Foundation of Tennessee, they can. And in cultivating these relationships, we have a lot of different partnerships like that, be it through FedEx or what we
Yeah, they do. Yeah, they do.
Definitely fundraising, or the love offerings is what I call them, from the various churches. When we do sickle cell Sabbath, or we're invited to come to a church to speak on sickle cell, and one church consistently has been giving us money for the past 7 years.
Okay, awesome.
Yeah, and people don't realize you're cultivating these relationships with, for instance, and it doesn't mean anything to your listeners, but if there's the Orange Mound Community Center, and these are some senior citizens in every year they give to sickle cell, and they're consistently giving $1,000 or more to us, and cultivating those relationships. So definitely a part of the community. And then last but not least, we were happy that we can start getting funds through working with the grant with the SCDAA.
Okay.
With the getting connected providers.
What about your United Ways? Do the United Way give you anything?
United Way gives us, because we're CFC, you can't be an official United Way member.
Yeah.
You have to have a choice.
Okay.
What we have had is that people can still designate to the foundation.
Okay.
Via the United Way, and they, of course, they take out an administrative fee. And matter of fact, we just received some funds the other day from CFC and the United Way. Literally 2 days ago.
Awesome. Well, okay, it's time for us to take another break, and when we come back, we'll continue speaking with you. You'll hang around, I hope.
Oh, yeah, most definitely. I'm enjoying it.
All right, thank you. This is the Sickle Cell Action Network Internet Radio Show. I'm Gary A. Gibson, your host, and we'll be back. Okay, welcome back to the Sickle Cell Action Network Internet Radio Show. The Sickle Cell Action Network Internet Radio Show is sponsored by Prolong Pharmaceuticals. Headquartered in South Plainfield, New Jersey, Prolong Pharmaceuticals, LLC, is developing products to treat several diseases and their debilitating comorbidities associated with reduced quality of life, increased medical cost, and significant mortality. A portfolio of hematology and oncology products is in development. Prolong is developing a new drug for sickle cell disease. The drug is called Sanguinate. Sanguinate, currently in clinical testing, is an investigational biopharmaceutical product that facilitates the transfer of oxygen to oxygen-deprived cells and tissues, focusing on treating the comorbidities of sickle cell disease and other disorders caused by anemia or hypoxia ischemia. Sanguinate is the only biological product currently in clinical development for the multiple comorbidities of sickle cell disease, and recently received an orphan drug designation from the United States FDA. Many of the comorbidities of SCD are caused by a spiraling cycle of sickling, hemolysis, and blood vessel inflammation. These comorbidities include vaso-occlusive crisis, acute chest syndrome, leg ulcers, and pediatric and adult stroke. By correcting oxygen levels and downregulating inflammation, Sanguinate has the promise of effectively treating many of the debilitating acute comorbidities associated with sickle cell disease. We are happy and proud that Prolong Pharmaceuticals has joined our family and our fight against sickle cell disease. Thank you for your support, Prolong Pharmaceuticals. We are speaking with Dr. Trevor Thompson from the Sickle Cell Foundation of Tennessee. He has shared a lot of great information right now, up to now so far, about what's happening with sickle cell in the Mid-South region. He's covering the state of Tennessee, parts of eastern Arkansas, and parts of northern Mississippi, doing a great job. Trevor, now that I've got you back, more and more funders are pushing social service agencies to form and participate in collaborations. And I'm just wondering, what are some of the collaborations that you might be working on there? You've sort of touched on them, but what are some of these partnerships that you've got in place?
Well, definitely our partner now is, of course, the original partner, I would say, was definitely Region 1, which is the base of the Dave Cross Sickle Cell Clinic, which I told you that served as the advisory chair for a number of years. And actually, Dr. Graves, who's the center director, is actually one of our board members.
Okay.
So we're excited to have that ongoing partnership with them. And then, of course, originally was with St. Jude. and we've always had some type of partnership with St. Jude. As a matter of fact, on a monthly basis, myself and or a staff member goes and supports their transition meetings. Again, I told you provide all the social services, and if we have an event, they're there to make sure that they publicize the event to their client base directly. And of course, like I said, we now take care of the camp for the kids there, as well as our fitness social services piece in terms of that. In Middle Tennessee, we have partnerships now with Meharry Medical School, which I told you about, Vanderbilt Sickle Cell Center there, led by Dr. Devon and Dr. Kassim on the adult end. And then in Chattanooga, where our other satellite area is, there's T.C. Thompson's Children's Hospital, in which we've had a long-standing relationship with them as well, with Dr. Keith Bolero. But those are the healthcare facilities. And let me not forget to mention Methodist Comprehensive Sickle Cell Center. They have a Sickle Cell Center now that's been around for about 3 or 4 years. And so we're fortunate in the Memphis area that we have 2 adult sickle cell centers that patients now have an option to select to get their care.
That is incredible, and I'm extremely jealous because we don't have any comprehensive sickle cell centers or dedicated sickle cell centers here in Indiana anywhere, and that's definitely one of the goals that we're pushing for. So good for you that you have 2 and people can even have a choice. How awesome is that? That's wonderful.
Yeah. People living with cancer have choices. Why can't people with sickle cell?
For sure. For sure. So what about this transitional housing service you've got? From what I can tell, I think you're the only sickle cell organization that provides that kind of service. So tell us, if you would, about the Carpenter House. How did it come to be? How is it funded? And how many people have you helped with it?
Man, I had to set up on that one. So I'm so proud of the Carpenter House.
And you should be.
But against their advice, a lot of people, and people who, some of my mentors actually didn't want me to get the house or do the house. Because when you're being a landlord, and if you've ever owned any type of property, you know the headaches that entails.
Yeah.
and having people live on property. And I'll have a few gray hairs because of that property. But what we began to notice and look at our data is that we started having people who needed a place to stay, somewhat quote-unquote temporarily. And we acquired the property. At one point, and let me just kind of backtrack real quickly. I know time is of the essence. But in 2008, people need to remember, yes, we had President Obama that was elected, but President Obama was taking us out of a big recession, remember?
Right, absolutely.
So the bubble burst for housing.
Right.
And so people provided opportunity where they were donating their property to the foundation.
Huh.
And it was an ongoing joke around here that we were cash poor but property rich.
Okay.
And so one of the properties that we had was literally almost a square block. And somebody made us an offer we couldn't refuse. And we also had a good friend of mine actually who helped start the Sickle Cell 5K here. Had some property and he wanted to give it away to my fraternity. And you had the fraternity role, so let me make sure I get that right. It's Alpha Phi Alpha Fraternity Incorporated. And they didn't want the property. And I told them, I said, once they turn it down, I want it. And his name was Kenneth Carpenter, and we named the house after him. And literally, we sold that property, that square block. And then a couple months later, we acquired the property from Kenneth Carpenter. And one of our board chair background is in construction, and he literally came from Atlanta. And in 37 days, he renovated that house, which is now called the Carpenter House. And it should have been on HGTV because you're in South Memphis, and it's not considered, it's an urban, low-income area. But if you ever walk in the house, you think that you're in high cotton, as we would say here in the country, because it's a beautiful home. And
Okay, yeah. Yeah.
And not only that, we began to look, and we were turning down a lot of women with children who needed a place to stay. So once our last guy kind of got on his feet, we transitioned it now for women.
Okay.
And the women are much better than the guys were.
Unfortunately, but probably true, yes. So, unfortunate.
Right now, with 3 years, we've had almost 20 people that live in the house. We don't put a time limit on how long you have to stay. We do have someone who actually just moved out last week, but we had 3 people living in the house and 1 person along with her child. And it's a safe environment. We have cameras everywhere. The police are friends in that neighborhood. The community has never bothered that house. As far as, our neighbors watch out for us and things of that particular nature. So it's been truly a benefit to the sickle cell community. And what we started to do also, we opened it up based off of the feedback actually from one of our mentors that you know from Gladys Robinson.
Uh-huh.
Gladys Robinson did a site visit and we took her to the house. And, she thought because there were a couple of bedrooms that were available that we should open it up to any woman that has a chronic disease.
Uh-huh.
Other than sickle cell.
Uh-huh.
And that's what we've done as well.
Okay.
So, so it's, like I said, it's been truly a benefit for women who've now been affected with sickle cell and or chronic diseases.
Are there any other qualifications or conditions that they have to meet in order to get residency there?
Well, we do a background check on everyone.
Okay.
The other thing I was there, and this is kind of why our numbers kind of stay low to a certain degree, because there are rules to the house.
Okay.
You can't just be leaving out the house at 11 o'clock or 1 o'clock in the morning because you're jeopardizing the stability and safety of other residents who live in the house.
Right.
You can't have anyone to stay the night. We do have a large refrigerator, and I'm from the country, so we say deep freezer.
Uh-huh.
For people that have their items, washer, dryer on the premise and things of that particular nature. But, no smoking in the house and things of that nature. And we've had people who just basically couldn't take the rules and decided to leave on their own. But we tried to work with, many people to, at least provide them some temporary housing.
Okay. So, obviously, by now it should be clear to you that I've been paying attention to the work that you're doing. And it seems to me that you're accomplishing quite a lot, Trevor. And so I'm thinking about you now. Trevor, you're the one I'm thinking about here. And it's like, how are you able to do all of this when you have sickle cell disease?
Gary, I'm very, I'm deep in faith. And me and my wife was having this discussion last night, actually, about just thanking God for giving me the opportunity to live out my passion or the work that I'm supposed to do. I am compliant about going to the doctor. I drink my water. I take my hydroxyurea. I've been on hydroxyurea now for probably a little bit over close to 20 years.
Really? Okay. Good.
Almost 11 years. April makes 11 years if I go to the distance that I haven't been hospitalized.
Awesome.
In terms of my sickle cell disease. I haven't taken a narcotic intentionally. One time I did. I got my pills mixed up. But
That wasn't intentional.
either so as well, since I've taken or anything of that particular nature as well. And I really just chalk it up to just being compliant, listening to doctors, staying on top of the research. I've gotten a little bit better now, 2 to 3 times a week now. I'll do 30 to 40 minutes on the treadmill. I actually got myself a membership. So I knew I had to do better in terms of
Well,
really being constructive. So you're not going to, unless I intentionally got a 7-year-old son, I have a 26-year-old daughter. Of course, I believe in family time, and you called that out. But typically you're not going to find Trevor just doing some. It's probably to my detriment to some certain degree, but I'm not going to do a lot of things that are just what I consider wasting my time.
Mm-hmm. Okay.
Well, I don't even get my car service. I have a laptop with me, and I'm taking care of business.
Taking care of business, Trevor.
Everybody knows my phrase, hey, handle your business. You got to handle your business.
Yeah, you got to handle your business, especially when the job is as big as it is. This job that we have, it's huge, and that's one of the reasons why I admire you, is because you recognize that and you're giving it your all in spite of the complications that could get in your way. So on behalf of all of those that have sickle cell, let me just take the opportunity to say thank you for giving of yourself in this manner. I also want to share, or have you share, some valuable information. Trevor, you and I were both fortunate enough to participate in the Sickle Cell Warriors Convention that was held in Hollywood last July and early August. And thanks again to Tosin Ola, Lakeela Bailey, and others for putting that event together. It was great. You were there, and you gave a presentation on financial management that I sat in on, and I think that, if you don't mind, would you share some of the information that you were giving out there? And this is really an important topic, and in all fairness to the situation, people that are challenged with chronic diseases, and I'm not just talking about sickle cell, but sickle cell is among them. People with chronic diseases don't often have the opportunities to be exposed to information like that which you were giving out in LA. So I think it's important. Some of our listeners could benefit perhaps from some of the things that you were sharing out there in LA. So if you don't mind, can we get into that a little bit?
Yes, man. Basically, as a man living with sickle cell, and when we have these conversations with men, the topic or the issue comes up about being a man living with a disease. Because as a man, we're taught to be a provider and a protector. And sickle cell, especially at various stages, could possibly limit that, because you can't work, or you can't even, in some cases, even defend your family. And if you think about the mental, social, psychosocial piece of even thinking of that, it really disturbs you on a consistent basis.
Right.
And I was fortunate enough to kind of grow up in a household in the country of Tuskegee. This is being a country boy. That I had a grandfather, and even my father talked about always. Now we call it multiple streams of income. When I was growing up, they called it making sure you had a side hustle.
Side hustle, yeah.
Because you just never know. And so I grew up in an era in which I was always working, and I mean at a very young age. So I don't know nothing but to work. But also I was taught at an early age to take care of your credit, and you owe somebody money, you pay them. If you can't pay them, then you give them a call and let them know, I can't pay you today, but this is when I will pay
Right.
So I was giving some of the tips, just basically, just common sense. And my grandfather really common sense, just, living within your means and not competing with the Joneses, and actually making a budget. And everybody spends, I don't care how broke people say they are, but when they start looking at how they spend their money, there are times that you can look and say, I really didn't need that, and looking at your needs versus your wants.
Uh-huh.
When I started really tallying up how much money I was giving to Starbucks every day,
right.
That's a lot of money. And then compared to, hey, I can do this movie at my house.
Right. Right.
It just takes a little bit more time and effort, but I can make this movie at my house, and how much money that could save me. So just making those changes in your life, and I'm fortunate enough that I have a spouse who's probably even more fiscally conscious and responsible than I am.
Okay.
Which is always a key, so she understands and doesn't care about trying to keep up with the Joneses and having the latest car and things of that particular nature.
Uh-huh.
And truly trying to save, because most Americans don't have $500 saved away just in case of an emergency. And I gave an example about the young lady from USM who gave $150,000 endowment, and she was basically a maid, for a number of years. But how she saved those nickels, and it just accumulated over time. And Gary, I'm gonna tell you something that I gave everybody a challenge that I started doing myself. Again, I've already done it, but I did it more consciously this time because I wanted to see how much I could save.
Uh-huh.
Me and my son have started saving all our excess change.
I do that too.
But I went further. Any extra money I get, in terms of, it could be, and we don't think of it in this terms, we get money, we think about how we're going to spend it. But say I get a mileage check, or you get, you're a consultant, you might get a little extra money you didn't intend to get from a speaking engagement, an honorarium, or whatever you might get, that you didn't expect, or you might have expected it, and it's outside my normal pay.
Uh-huh.
I started stashing it.
Uh-huh.
And people would be shocked on how much money they can begin to save. Me and my son, we've already gone through a couple of containers going to Coinstar, and I said we're not gonna get lazy. We're gonna start wrapping our own money, because we got to get Coinstar a little bit more than 10%.
Right. Right.
All that for you.
Wrap them and take them to the bank.
Wrap them and take it to the bank.
Yep.
But after every trip we're going, it's more than $100 in coins that we saved up to some change.
Mm-hmm.
And so it's getting people to think on a whole different mindset, to be dependent on themselves, to save for that rainy day, and trying to put yourself and or your family in a different financial position. The other thing, and I know we're on the radio, so we have a lot of time, but I started investing in products that I utilize. And I'm not the best person when it comes to talking about the stock market and things of that nature, but, a lot of us, I ask the question, a lot of us stay on Facebook. We love Facebook. But I ask the question, how many people own Facebook stock?
Good question.
And so if you would have bought Facebook stock like I did when it first came out that day, your money has already tripled almost.
And you did?
Yes.
Oh, wow. Oh, wow.
It's just doing that type of, investing. Yes, can I afford to buy several different pairs of shoes and suits and custom suits and all that kind of stuff, and a brand new car? Yeah, I can afford a brand new car, but I'd rather invest in the future of my family and generations to come than into material things. Now, yes, I want something that's safe and operational.
So basically, you're talking about common sense and practicality.
Common sense and practicality.
Yep, common sense and practicality. All right, Trevor, we're going to come back and touch on that topic one more time, but now it's time for a break, and this is the Sickle Cell Action Network Internet Radio Show. I'm Gary Gibson, your host, and we'll be back. Ladies and gentlemen, welcome back to the Sickle Cell Action Network Internet Radio Show, and we are speaking with Dr. Trevor Thompson from the Sickle Cell Foundation of Tennessee. Great conversation so far, sharing lots of good information, doing lots of good work, and I'm just really thrilled that he was able to spend this evening with us. And I'm going to come back and just want to close the loop on the financial planning that we were talking about before the break. Trevor, you have a lot more, I know, that you can offer with regards to financial planning than we're able to give on the show. But let me ask you this. What are some things that people should avoid, if there's anything additional to what you said before the break?
That's a good question there. What should people avoid? The biggest thing people, I would say, I'm not one to go for fads, and meaning something that's, a temporary fashion statement.
Right, as an example, what? The latest Air Jordan shoes, perhaps?
Latest Air, well, even for my children, I don't spend any more than probably $70 on tennis.
Okay.
I'm not paying a couple $100s on tennis, not even for myself.
Uh-huh.
My dad will say, and anything that's on your body is not an asset. And I'll keep it clean that way. Yeah.
Right.
What's on your body is not an asset.
Uh-huh.
And those are the big things that we get, because especially in the African American community, we are huge consumers of material goods.
Absolutely.
But and I'm not sure people remember. But I remember going to college, I only had 1 or 2 dress shirts.
Uh-huh.
And I had a washboard and some octagon soap, and I would wash it up and hang it up, and it'd be good and ready. And I'm not saying people don't have to go to that limits, but I think we kind of overindulge as far as consumerism is concerned. We really don't take time to really think about, do I want this or do I need this?
Big difference, right?
Big difference.
Big difference.
Can I really, and I have some funds that I can actually buy a lot of things that I want, but I really take time and I really go through this methodical dance in my head about, do I really need this?
Uh-huh.
What else might be coming down the pike? In which these funds could be better utilized. And you're in a unique situation just like I am, because when you're CEO or founder of your own organization, you have to be very responsible, especially as a business owner, of your funds.
Right.
Because your funds ebbs and flows based on, funding coming in and things of that particular nature. So your mindset is somewhat different than the average person. But if everybody had the responsibility that we entail, that would make them a little bit more conscious about their spending habits.
It drives me crazy sometimes, Trevor. I like to go into stores. I really like, high-tech stuff and all of that. And I'll go look at the stuff, and I keep thinking, yeah, I can buy this. But I go through that same mental exercise you do, and I typically walk out of the store empty-handed every time I go. Sometimes I even go saying, this time I'm going to buy something, and I still walk out empty-handed. So I know exactly what you're talking about. I just can't bring myself, because I do that, what you just said. Do I really need it? And I say, nope, I don't really, so I walk out. So I know exactly what you're talking about.
And this is something else I'll share what I'm trying to teach my son as well, because there's no point in saving or trying to build wealth for your future generations if they're going to be irresponsible for it because they weren't trained.
Right. Good point.
Like most children, they want the newest and the greatest Nintendo. And so we've had my
Right,
And
right.
I tell you what, when you go to Generation X, there's tons of those old school Nintendo games that are there.
Uh-huh. Huh.
Yeah.
Okay. All right, well,
Just changing your mindset and how you spend your money.
what you need versus what you want. It's pretty simple. Like we said, common sense and practicality. So I'm going to switch gears as we get ready to start winding down here, and I'm going to ask you if you had a chance to do an interview on Good Morning America, what would you tell their audience about sickle cell? National audience now, and you're on Good Morning America, and for some strange reason they decided to talk about sickle cell. What would you say?
Of course, I would give them an education that's an inherited blood disorder, predominantly African Americans. But I do want them to know it's not what someone walks up to me and say, "Hey, that's a black folks disease, isn't it?" And I educate them know that it affects Italians, Greeks, and other people of other ethnic groups. I want to make sure I provide that type of education. However, I would also let them know in 2016, you're talking about individuals who are still stigmatized, undervalued, and marginalized because of their disease. When we think about social justice, we think about terms of the issues that are happening in the African American community, but we don't think in terms of health disparities.
Right.
And here in 2016, sickle cell disease, and how sickle cell clients or consumers are treated, is still a major health disparity.
Absolutely, major health disparity.
And, even though we might hear about the one or two people or periodically people being cured from the bone marrow transplant, but that's still not a universal cure.
Right.
And so
Okay.
that's our goal, is to still find a universal cure. We still want people being treated with respect and dignity as if they were a cancer patient. Who goes through pain and goes through, a tremendous amount of issues going through cancer. We don't undervalue or marginalize what a sickle cell patient goes through as well.
Okay. Now, another question. As a leader in our field, Trevor, what do you see as the top 3 challenges or issues that we face?
Top 3 issues that we face, I would say, ill stigma.
Yep.
Number 2 would be still the issues of emergency rooms.
Right.
Clients 70 hours waiting to be seen by a physician.
Right.
And the third one might surprise you that this is something that's new to Trevor, doing a better community outreach in terms of the rural communities,
Okay.
or those medical deserts, because Knoxville is not a rural community, even though most people think Tennessee is a rural state. But I had a call today from somebody from Knoxville, Tennessee, which is a major quote-unquote urban center in Tennessee.
Right.
But there's no sickle cell doctor there
Right.
for treatment. So, those medical deserts or rural areas that people are not getting good health care.
Okay, good. So what about, from your perspective, what are the top 3 things that are giving you hope for the future for sickle cell?
Oh man, that was probably easy. I had the opportunity to sit on the American Emergency Room Physicians Coalition and to see physicians engaged in wanting to eliminate this issue of patients being in the emergency room. That gives me hope that they recognize it's a problem. They have established a coalition around it and looking into establish protocols to deal with that
Yeah.
And I tell people all the time, it's not a coincidence that sickle cell is the first molecular disease that's studied.
Right. Right.
So even in precision medicine, or you might hear about called genotype medicine, you know, that's what they're looking at sickle cell first, and possibly doing gene therapy and things of that particular nature. So that gives me hope. And also what gives me hope is that because of social media, because of technology, how it's easier to connect to even more individuals that are affected with the disease. When I was traveling to SCDA in '95, it was real hard for me. And I hate alienating people, but it was very important for me to meet a
Ivy, Dr. Ivy, yes.
Dr. Ivy, who had graduated medical school living with sickle cell.
Right.
Or Carolyn, or a lot of different educated individuals living with sickle cell. And that gave me hope, because it was kind of refreshing to meet someone who was a professional living with disease, kind of going after their dreams and aspirations. And so when I got my doctorate, actually my dedication is to Darnell, because he gave me a visualization that it could be done.
Awesome.
It gives me hope that now we can connect even quicker than just going to a conference, because of the social media platform and meeting other thousands of individuals living with disease, or providing some kind of benefit to those families who are seeking our advice.
There are a lot of things for us to be hopeful for, and I mean, I'm looking at that and appreciate your answer, but certainly gene editing is something that is giving me a lot of excitement, and I know it has a couple of issues with it, but there's the promise there that, you know, maybe one day this can become the more widely available cure that we've been needing for so long. I'm excited about that. I'm excited about the interest with the pharmaceuticals that you talked about. The pharmaceutical companies are showing a tremendous amount of excitement, and honestly, more research. You know, I looked at that just the other day, and I saw that there was approximately around $75 million was supposed to be spent on sickle cell research last year. Now that's good. That's a lot of money, but here's the deal with the disparity. Back to that, cystic fibrosis, they're scheduled for 80 million, so 5 million more, and they have 1/3 the number of patients, and so they're still it's still out of whack, but it's better than it was. So I guess that gives me hope to see that people are waking up and seeing that there is this social injustice, as you said, and I like that term. I use it quite a bit myself, that we need to stop that and improve the situation. So thank you for your answers, Trevor. Here's a good question. If someone you know won the Tennessee lottery and they decided to give your foundation $1 million, what would you do with it?
Oh, I already got the plan written up. I already know the budget and everything. I would. Our biggest issue is infrastructure. And when I say infrastructure, not in terms of an administrative piece, but in terms of actually having those community ambassadors or community health workers designated throughout the state, then that's the kind of system I want to set up that is permanent, that, you know, we can sustain actually having people in the field who are educating, training, treat testing, and what have you, in terms of sickle cell.
Okay.
So like we have these satellite offices, but I want permanent offices.
Right.
And not only in the urban centers, but definitely in the rural communities. Again, I'm in Springfield, Tennessee.
Okay.
So I was office in West Tennessee, or Arkansas, Mississippi, at the borderline of Kentucky, out there, Knoxville, and other areas as well.
Okay, thank you. You know, there might be people that are listening that would be in your area, so let's be sure that they know how to get in touch with the Sickle Cell Foundation of Tennessee. If you don't mind, would you share with listeners what your phone number is, what your address is, or you know, even your email, not your personal email, but you know, your website and stuff like that.
All right. Yeah, one
All that stuff.
That's on site.
All that stuff. Trevor, is there anything else you'd like to add before we let you go? Definitely, we thank you for your generosity with your time today. Is there anything else you'd like to add?
No, I guess to kind of leave a charge to, those people that are affected with sickle cell that, if you ever read the book, Tuesday Mornings with Maury, and he talks about that, the disease, might have your body, but doesn't have the spirit. So, keep your spirits up. Go after that dream and that passion that you have. I'm one who pushes entrepreneurship. And if you want to continue your education to go on, it might take you a little bit longer than everyone else, but go after that dream, go after that passion, and just take care of yourself. Be compliant, do the research. There are a lot of clinical trials out there, but we want you to be educated in terms of clinical trials. But you too can have a great life living well with sickle cell.
Thank you, Trevor Thompson. Very well said. And also stand up and be counted, right? When it comes time for that advocacy, stand up and be counted. All right. Well, thank you. I'm going to let you go now. Again, we thank you for your time, and I'm looking forward to speaking with you in the future and watching all the good things you're doing. Thank you, Trevor Thompson, Sickle Cell Foundation of Tennessee. All right. It's time, as usual, to close out the show with something for you to think about. I'm starting with a quote today that says, "Try to see things differently. It's the only way to get a clearer perspective on the world and on your life." These are the words of Neal Shusterman. Neal Shusterman is an American writer of young adult fiction. He won the National Book Award for Young People's Literature for Challenger Deep. He has received numerous honors for his books, including the Boston Globe Horn Book Award and the 2008 California Young Reader Medal. It doesn't really matter who you are, where you come from, or whether you have an illness. What matters for all of us is that we try to keep things in perspective. You know the old saying, the grass is greener on the other side of the fence? Well, it's only when you get over to the other side of the fence that you see the grass isn't as green as it looked from afar. Such is the case with rare and neglected diseases. I mention this because last week I had the opportunity to give a lecture on sickle cell disease to some master's level students at the University of Notre Dame. The lecture was coordinated by Dr. Katsuri Haldar of Notre Dame's Bowler Parsegian Center for Rare and Neglected Diseases. Dr. Haldar and her team are doing cutting-edge research, and I was honored to have an opportunity to learn about some of the things that they are working on. What I saw was quite impressive, but I also learned some things that made me think about how important it is to keep things in perspective. As an example, I learned a little bit about a disease called Niemann-Pick type C. NPC is a genetic disease that can occur in any ethnic group. It causes abnormal accumulation of cholesterol in cells of the body. Symptoms of NPC include deterioration of memory and balance, seizures, lung and liver failure. The disease usually appears in early childhood. Currently, there is no cure, but supportive therapies are available and research is advancing. Niemann-Pick type C is always fatal. However, life expectancy depends on when symptoms begin. If symptoms appear after 8 years of age, an individual is likely to live until about 20 years of age. Another example is NKH disease. NKH stands for non-ketotic hyperglycemia. It is a rare genetic disorder that affects one child in every 60,000 born. Children with this condition have a problem breaking down the amino acid glycine. This is caused by a defect in the genetic code for the machinery that is responsible for the glycine breakdown, called glycine cleavage enzyme. Just like it is with Niemann-Pick disease, there is no cure for NKH. However, there are treatments that can improve outcomes. Unfortunately, many of the babies born with NKH die soon after their births. Those that survive longer than that soon encounter developmental problems that affect their ability to think and function. Interestingly, both NKH and NPC are spread in the same way that sickle cell disease are. They are all autosomal recessive disorders, meaning that the gene for the disease is provided by both parents. Of course, the other thing that these patients have in common is that they were not given a choice. But let me ask you this: which would you rather have? A disease that causes you periods of intense pain but otherwise allows you to experience most of the good things that life has to offer? Or would you rather choose a disorder that doesn't let you live long enough to learn, play, and love? That's why it's important to keep things in perspective. This is to not say that sickle cell is a cakewalk. It most certainly isn't. But both NPC and NKH should prove one thing to those who do have sickle cell: it could always be worse. That's our show for today. Please join us again next week. Same time, same station.